So I started playing tennis when I was 4 years old. I just played for 15 years, and I would play with like high-level players. Like I would get sick sometimes. My coach knew I had something, but he didn't necessarily know that I was CAH. Because obviously he would want to push me when I was playing, and that makes sense. But then sometimes I would have to tell him like, listen, it's not because I don't want to. I definitely consider myself a driven person for sure. Again, I was the type of person that never missed homework. Like I never missed a single assignment or deadline. And I think it was just like my want to control my life. I started taking control of my CAH like towards the end of high school. With CAH, you might feel fine, but the blood results don't show that necessarily. I kind of started to actually care about like a lot of my results, a lot of my blood work, etc. And I became more invested as well in the trial or wanting to join the trial. I chose the Catalyst trial mainly for the potential to lower my androgens and, lower my steroid usage. I'm taking Crenessity twice a day, morning and night, every day with a meal. My doctor told me some side effects of Crenessity are fatigue, dizziness, and joint pain. My personal experience, I didn't have any side effects. After taking Crenessity, my 17 OHP went down and my A4 went down. Because Crenessity lowered my androgen levels, my doctor was able to lower my steroid dose. Definitely went down from 25 milligrams, which was the baseline, to about 17.5 milligrams of hydrocortisone. Knowing that my lab results have gone down because of Crenessity, I definitely feel better about the long-term impact. It did give me peace of mind that my levels were in the more normal range. At the end of the day, I'm the one that's going to be looking out for my future the most. I would tell people who are considering Crenessity to talk with their doctor. I've had a good experience, and you should talk to your doctor about what your experience on Crenessity might be.
Important safety information. Approved uses. Crenessity crinecerfont is a prescription medicine used together with glucocorticoids, steroids, to control androgen, testosterone-like hormone levels in adults and children 4 years of age and older with classic congenital adrenal hyperplasia, CAH. Important safety information. Do not take Crenessity if you are allergic to crinecerfont or any of the ingredients in Crenessity. Crenessity may cause serious side effects, including allergic reactions. Symptoms of an allergic reaction include tightness of the throat, trouble breathing or swallowing, swelling of the lips, tongue, or face, and rash. If you have an allergic reaction to Crenessity, get emergency medical help right away and stop taking Crenessity. Risk of sudden adrenal insufficiency or adrenal crisis with too little glucocorticoid steroid medicine. Sudden adrenal insufficiency or adrenal crisis can happen in people with congenital adrenal hyperplasia who are not taking enough glucocorticoid steroid medicine. You should continue taking your glucocorticoid steroid medicine during treatment with Crenessity. Certain conditions such as infection, severe injury, or shock may increase your risk for sudden adrenal insufficiency or adrenal crisis. Tell your healthcare provider if you get a severe injury, infection, illness, or have planned surgery during treatment. Your healthcare provider may need to change your dose of glucocorticoid steroid medicine. Before taking Crenessity, tell your healthcare provider about all of your medical conditions, including if you are pregnant or plan to become pregnant, or are breastfeeding or plan to breastfeed. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. The most common side effects of Crenessity in adults include tiredness, headache, dizziness, joint pain, back pain, decreased appetite, and muscle pain. The most common side effects of Crenessity in children include headache, stomach pain, tiredness, nasal congestion, and nosebleeds. These are not all the possible side effects of Crenessity. Call your healthcare provider for medical advice about side effects. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit MedWatch at www.fda.gov/medwatch or call 1-800-FDA-1088. Dosage forms and strengths. Crenessity is available in 50 milligram and 100 milligram capsules and as an oral solution of 50 milligrams per milliliter. Please see the accompanying full prescribing information or find it at www.neurocrine.com/CrenessityPPI.